the House Oversight Committee is having hearing on universal health care. And AOC and Katy Porter. Katy Perry did not show up. Apparently, they were hoping that she would. Avril Lavigne also.
Good job.
2 names of like.
Good job.
Katy Porter and AOC took the time to introduce the idea that Medicare for all is the most efficient way of delivering health insurance for everyone. And here she is talking with Dr. Sara Collins. She is the Commonwealth Fund Vice President. Commonwealth Fund is I guess you could call it a think tank about health policy. Here is that exchange.
Thank you so much, Chairwoman Bush, and to all of our witnesses for being here today. But I just have to underscore how grateful we are for Representative Bush's leadership and determination in securing such a historic and unprecedented hearing, not just for this committee, but for the country. So thank you. We know that private insurance is the primary health coverage for 2/3 of Americans, with the majority of private insurance being employer-sponsored. But what I think most people in the US, most working class people need to contend with is the fact that the money employers spend on health benefits, and particularly for-profit private health insurance, comes from the money that they would have otherwise spent on our wages. Dr. Collins, in 2020, the standard company-provided health insurance policy totaled over about $7,000 a year for single coverage and over $21,000 a year for family coverage. Is that correct?
Yes.
And with employer-sponsored insurance, your employer pays a large portion and you pay a smaller portion, correct?
Yes.
So in the case of individual coverage, if the total cost is around $7,400 and your employer pays, say, $6,200, and then you pay around $1,200, now that's thousands of dollars more that everyday people could be saving per year if it weren't going directly to insurance companies' private profits, correct?
Yes.
Interesting. So one of the things that we're really seeing here is that the potential to moving to a Medicare for all system could actually give people a raise in many circumstances. Now, a common rebuttal to that, and a common rebuttal to Medicare for all that you'll hear from conservatives and the right, is that we would merely just change the way in which that same premium is charged, and that those same dollars would come that are coming out of our paychecks now will then just be coming out in the form of taxes. But the truth is that Medicare for all actually lowers the overall cost of healthcare as well. Dr. Collins.
There you go. I mean, all that's true. And, important that the American public hears this. I don't know how much of the American public is going to hear this, but it's good they're getting it out there. It's good they're getting it on the record. You'll notice that there was no one else sitting in these committee hearings. But again, it is to communicate to the rest of the country these concepts, ones that Bernie Sanders introduced to people. And so it's happening. Now, I'm going to, one should not assume that just because in Congress people say these things, whether it comes out of committee in some type of vote or not, that it's going to, the American public is going to rise up and take notice. But I'll tell you what is happening is that you're getting a generation of politicians who do not have necessarily the power in leadership, but you're getting a generation of politicians who are telling their colleagues and who are communicating to people of their generation that this is the most obvious thing to go to.
Yeah. And in terms of, some of the concepts that she's breaking down there as well, I'm not sure if she gets into it later because that was a longer video than what we played, but it helps in terms of union leadership may want to hang on. Some union leadership may want to hang on to their healthcare plans in a way that I don't necessarily agree with. But in terms of like the broader context, this helps in terms of union negotiations with employers and with bosses, because you take healthcare out of the equation in that sense. If you do have Medicare for all, it allows for higher wages, both in terms of the costs of what's being taken out of your paycheck, but also in terms of negotiating those higher wages, because there's less bargaining power from the employer.
That's exactly it. I mean, it has become increasingly apparent, I think, not just to me, but to, I think, broadly in society, that healthcare is not just about the cost in terms of that relationship between employer and employee. It is about control. And I think we are seeing, a lot of the great resignation. I mean, there's more data out there. People are still leaving their jobs,
Right.
and it increases the wage leverage of workers. But why are they doing that? Because we are at probably one of the highest levels of health insurance coverage that we've seen in this country's history at this point. And much of that is a function of subsidies that still exist under the COVID relief bill. Now, COBRA, I think that has ended as of like last fall, late fall, but there's a lot of subsidies in terms of the Affordable Care Act where it frees people up a little bit. But that dynamic could get increased. And I think to a certain extent, that's why when you see there's multiple fronts that are fighting against Medicare for all. One of them is the medical providers. To some extent, it's the insurance companies. But again, I think that there's still money for them to be made in just the administering of a Medicare for all type of program. And they're just not that huge of an industry, despite the fact that they make our healthcare so inefficient. But medical providers are a big one. I think that in some instances, some unions are a big one because they perceive that as the biggest value add that they offer people. Sometimes people get fixed in their old ways and don't have the vision to see beyond that. And then the other part is, I think, just broadly speaking, employers want to control their workers.
Yep.
And this is a big, big, big source of control, because it's not, it's not just you as an individual, it's your family too that is jeopardized.
You want better conditions. You want to be treated better by your boss. You want maybe to find something else, become self-employed, do what you want to do. Well, you need the health insurance.
Yeah, I mean, all the things that supposedly like Bitcoin or something, it's going to allow like artists and creators to get money. Like, no, if you want to support any sort of failing industry, whether it's news, musicians, West Virginia miners, you give them healthcare. Also, it's a solution to cancel culture, or at least it goes away to ameliorate the negative effects of cancel culture, because one of the biggest problems with cancel culture is you lose your job and ability to provide for yourself. If we took that off the table, healthcare, then all of a sudden these conversations become a little bit less, the stakes become a lot lower.
Yeah. I mean, if cancel culture was a good faith debate about it, not just people who are wealthy.
But it's like, it goes back to like the John Ronson book of public shaming. It's like, I think public shaming, like if you do something that gets misinterpreted or overinterpreted, the social ramifications are awful. But it's really the material factors where your inability to like get a job in the future, like to go to a hospital if you're sick, that stuff needs to be taken care of. Then a lot of this stuff doesn't matter, which, we're not talking about the right thing is what I'm pointing out.
Right.
Someone suggested we get Ronson on for his, just did a podcast on satanic panic.
I saw that I wrote that down because I want to listen to that. That sounds good.
He's a great writer, and he also does like radio shows going way back. So I bet he did a good treatment of that.
I'm going to download that podcast.
Okay. Take it easy. Don't need to advertise too much. Other shows. Jeez, Pete.